7 everyday medications that can damage your kidneys. Our kidneys are incredibly hardworking organs, filtering around 50 gallons of blood each day to remove waste and extra fluids. This important function keeps our bodily fluids in balance. However, many people aren't aware of some common medications that harm the kidneys over time. These drugs, often taken for pain relief, colds, or chronic conditions, can cause kidney damage if used frequently or in large doses. So, let's see what those medications are and how they can damage the kidneys. As we age, kidney functions naturally declines, making it harder for the kidneys to filter out drugs effectively. Studies show that individuals over 65 are more likely to experience kidney damage from medications. Additionally, older adults often take multiple prescriptions, increasing the risk of drug interactions that can harm the kidneys. According to a study published in the Clinical Journal of the American Society of Nephrology, older adults have a significantly higher risk of hospitalization due to drug-induced kidney injury. So, it's crucial for this age group to manage medications carefully under medical supervision. Now, let's see what those commonly used medications are. Proton pump inhibitors. Proton pump inhibitors, or PPIs, are a class of medications that reduce the production of stomach acid, commonly prescribed for conditions such as heartburn, acid reflux, and ulcers. While they are effective in managing these conditions, long-term use of PPIs has been linked to significant kidney damage. Research indicates that PPIs can lead to chronic kidney disease and even kidney failure without prior signs of acute kidney problems. A study involving over 125,000 patients found that more than half of those who developed chronic kidney issues from PPIs did not experience acute kidney problems first, meaning the damage can progress silently and gradually. PPIs are associated with a 20 to 50% increased risk of CKD compared to non-users. This increased risk is concerning given the widespread use of PPIs, both by prescription and over-the-counter. Experts recommend that patients and healthcare providers carefully evaluate the necessity of PPI use and consider alternative treatments when possible. Regular monitoring of kidney function in patients taking PPIs is crucial to prevent long-term damage and ensure early intervention if problems arise. Laxatives. Laxatives are often used to relieve constipation, but long-term or improper use can lead to serious kidney damage. Certain types of laxatives, particularly those containing sodium phosphate, can cause a condition called acute phosphate neuropathy, where phosphate crystals form in the kidneys, leading to kidney injury or failure. Some sodium phosphate laxatives, which are used for bowel cleansing before procedures like colonoscopies, pose a higher risk. Symptoms of kidney damage from these laxatives can include lethargy, swelling, and decreased urination, but many people may not notice any symptoms until significant damage has occurred. In general, over-the-counter laxatives are safe for short-term use, but prolonged use or higher than recommended doses can lead to dehydration and electrolyte imbalances, further straining the kidneys. This is particularly concerning for older adults, people with chronic kidney disease, or those taking medications that affect kidney function, such as diuretics and NSAIDs. To reduce these risks, it's crucial to use laxatives as directed and consult a healthcare provider if they're needed frequently. Antibiotics. Antibiotics are another class of medications that can cause kidney damage, especially if not used correctly. Certain antibiotics, such as aminoglycosides, vancomycin, and some beta-lactams, are known for their nephrotoxic potential. These antibiotics can cause acute kidney injury by directly damaging kidney cells or causing an immune response that leads to inflammation and scarring in the kidneys. The risk of kidney damage increases with larger doses and prolonged use, making it crucial to follow the prescribed regimen and complete the full course of treatment. Patients with pre-existing kidney conditions, the elderly, and those taking other nephrotoxic medications are particularly vulnerable. It is important for such individuals to have their kidney function monitored regularly while on antibiotics. Healthcare providers might adjust dosages or choose less harmful alternatives when necessary to minimize the risk of kidney injury. Antiviral drugs. Antiviral drugs, essential for managing viral infections like HIV, hepatitis, and herpes, can significantly impact kidney health. Some common antiviral drugs are particularly notable for their nephrotoxic effects, meaning they can cause damage to kidney cells. For instance, a wide one used in the treatment of HIV is known to cause kidney tubular damage and chronic kidney disease. The nephrotoxic potential of antiviral drugs is compounded in patients with pre-existing kidney conditions, the elderly, and those taking other nephrotoxic medications. These patients are at a higher risk of developing acute kidney injury, or AKI, or worsening existing CKD. Additionally, hydration status can influence the risk of kidney damage from antivirals. Dehydration can increase drug concentrations in the kidneys, exacerbating their toxic effects. Healthcare providers often advise patients to maintain adequate hydration and avoid concurrent use of other nephrotoxic substances. By closely monitoring kidney function and adjusting treatment as necessary, the risks associated with antiviral drugs can be mitigated, ensuring that patients receive the benefits of antiviral therapy while minimizing potential harm to their kidneys. Ibuprofen. Ibuprofen is a commonly used non-steroidal anti-inflammatory drug, or NSAID, taken for everyday pains like headaches and muscle aches. It is widely known for its potential to cause kidney damage, especially with long-term use or in high doses. Ibuprofen works by inhibiting cyclooxygenase, or COX enzymes, which are involved in the production of prostaglandins. Prostaglandins help maintain adequate blood flow to the kidneys by dilating blood vessels. By reducing prostaglandin levels, ibuprofen can decrease renal blood flow, leading to acute kidney injury, or AKI, and potentially exacerbating chronic kidney disease. A study published in the Clinical Journal of the American Society of Nephrology found that NSAID use is associated with a higher incidence of kidney-related hospitalizations, particularly in patients with CKD. To minimize the risk of kidney damage, it's crucial to use ibuprofen at the lowest effective dose for the shortest possible duration. Patients with kidney concerns should consult healthcare providers before using NSAIDs and consider alternative pain management options. Contrast dyes. Contrast dyes are used in medical imaging procedures such as CT scans and MRIs to help improve the visibility of internal structures. These dyes, however, can pose a risk to kidney health, particularly for those with pre-existing kidney conditions. The two main types of contrast dyes are iodine-based, used in CT scans and angiograms, and gadolinium-based, used in MRIs. Both types have been associated with contrast-induced neuropathy, or CIN, and nephrogenic systemic fibrosis. Contrast-induced neuropathy is a form of acute kidney injury that occurs within 48 hours of exposure to iodine-based contrast dyes. The incidence of CIN can range from 2 to 50%, with those at higher risk, including individuals with chronic kidney diseases, diabetes, and older age. Preventative measures such as adequate hydration before and after the procedure, minimizing the dose of contrast dye, and using alternative imaging methods can help reduce the risk of CIN. Gadolinium-based contrast agents, while generally safe, can cause NSF in patients with advanced CKD. NSF is a rare but serious condition that leads to skin thickening and can affect internal organs, sometimes resulting in severe pain and disability. Patients should discuss their kidney function and the potential risks with their healthcare provider before undergoing procedures that involve contrast dyes. Awareness and precautionary measures are crucial to minimize the risks associated with these diagnostic tools. Diuretics. Diuretics, commonly known as water pills, are medications used to remove excess fluid from the body by increasing urine production. They're often prescribed for conditions such as hypertension, heart failure, and edema. While diuretics are effective in managing these conditions, their impact on kidney function requires careful consideration. Diuretics work by altering the balance of salts and water in the kidneys, which can lead to electrolyte imbalances and dehydration if not monitored properly. Chronic use of diuretics can reduce blood flow to the kidneys, potentially causing kidney damage over time. For patients with pre-existing kidney conditions, the risk is even higher, as their kidneys are already compromised and less able to handle the stress induced by diuretics. So, older adults should regularly review their medications with healthcare providers, use the lowest effective doses, and avoid combining nephrotoxic drugs. Monitoring kidney function through regular tests and staying well hydrated are crucial steps to prevent unwanted kidney damage. If you enjoyed this video, then make sure to check out the next one shown on screen.